Hello everyone. Today in this video I'll be demonstrating exercises for strengthening hip joint muscles. We had one suggestion from a parent to demonstrate exercises for hip muscle strengthening. Now I'll let you know first in which conditions you might need these exercises for your child. If your child is suffering with delayed development, hypotonia, cerebral palsy, and conditions like Down syndrome where there is muscle weakness and hypotonia as well. So in these conditions, you might need exercises for hip muscle strengthening which will help in developing their balance as well as improving their standing and walking as well. Today in this video, we will see exercises which can be done easily at home without any major exercise equipment. So let's begin, and yes, I'll be demonstrating those exercises on my son. We'll be using a chair, pillow and a ball. Okay, please come forward and lie down. Your child needs to lie down on the floor. Now, if your child needs assistance, you will hold their legs and keep it on the chair. Yes. You might need to come slightly downwards. Okay. Yeah. Now, in this video, the first exercise over here is a kind of leg press exercise, but I'm doing it individually and alternately on each leg. First, we will start with the right side. You have to pull your knee towards your chest. Good, good. Now push my hand. Push, push with your feet. Push it with your feet. Push it, push it. As you can see, over here I am giving resistance with my hand for strengthening the anterior thigh muscles. Push it. Come on, push it, push it, push it. I am stabilizing over here at the knee joint. And I am applying force over here to resist the movement. So this resistance will help in strengthening the anterior thigh muscles. Do repeat this exercise for 10 times and total 3 sets on each side. Okay, same way, push, push, push. So you need to repeat it 10 times on each side and do 3 sets on both the sides. Now in next exercise, we will do a kicking movement. This movement will assist in straightening of knee joint. See, if your child has difficulty in walking and particularly they are not able to straighten their knee properly while walking, then this exercise is very much helpful in that case. Now what you have to do is, you have to simply try to kick this ball. Okay? Kick it with your right leg. Good. Kick it. Good. Now what you can do is, if your child gets very familiar with this activity and they are able to do it easily, what you can do is, you include holding time in this. See, you will kick the ball and you will keep your knees straight until the count of 5. Okay, I will count 5. Kick. Hold it there. 1, 2, 3, 4, 5. Relax. See, I am not stabilizing knee joint over here because I want movement at knee joint. But if you notice that there is any unusual movement at hip joint, or your child is slightly twisting their hip while giving a kick, or there is some kind of movement at trunk, you can of course use one hand to stabilize their hip joint and then ask them to kick. Kick the ball with right. Hold it. 1, 2, 3, 4, 5. Relax. Again, this exercise also needs to be repeated on both sides. If your child has weakness on any one particular side, of course you can do it on that side only. Repeat it for 10 times and do for 3 sets on both the sides. Okay. Now we'll move on to the next exercise. In next exercise, we'll be targeting the rotators and the abductors. Okay. I have come across questions where a child has tightness or spasticity of this adductor group of muscles, the inner thigh muscles, where they have a scissoring kind of pattern while walking. They cross their legs, they're not able to separate them well. So in this exercise, I'll be showing that. You just come slightly downwards. Yes, yes, yes. We need to make sure that the chair goes on sliding and sliding. So yes, I've chosen this corner for that purpose only. What we'll do is, I'm showing it first. You also demonstrate it first to your child so they get an idea how to do it, and then you can continue without giving assistance. Here I am assisting the child. Yes, move it outwards, outwards, outwards like this. Now, if your child is able to do on their own, let them do it up till the range, till when they are able to do it on their own. Now, if you feel that after this range, they are not able to open up their legs well, you give slight push outwards. Okay? Again. Great. Why I have chosen this position is because a child can easily see the movement occurring over here at the legs, and this visual input or visual feedback helps as a motivation for the child. You can even use I can say some kind of toy or some points over here. You can put one teddy bear over here and you can ask your child to try to touch the teddy with their knee, or you can of course use some smiley stickers and ask them to rotate it outwards to move the smileys inwards and outwards. So you can use those as reinforcements, and of course this visual feedback also helps a lot, and this is a very comfortable position for a parent also to execute this exercise. Okay, so this is particularly going to stretch the inner thigh muscles as well as going to strengthen the outer thigh, or the the abductors and the rotators, external rotators. Good. Now in the next exercise, I will be combining hip strengthening as well as midline crossing exercise, and this can help a lot if you want to focus on the core muscles as well. Now what you have to do in this exercise, take your hands upwards. Okay. Ask your child to pull the knees towards the chest and touch it with the opposite hand. That is right hand on left knee, left hand on right knee. If your child needs some assistance, of course you can help your child initially. Okay, do it. And when they are coming back, you can ask them to push. Yes. Do it. Try to go for 30 times total, like this way. Yeah. This is 1, this is 2. So go for 30 repetitions, and 1 set will be enough. If you are doing the knee press or pushing exercises, the first one, if you are doing that also and combining this exercise as well, then 30 total of crossing the cross crowds will be enough. Now moving on to the next exercise. In this exercise, child will be coming in kneeling position. Take your legs down. Slightly upwards. Yes. You have to get up. Okay, fine. Stand here. Okay. Again, I am using this cushion over here to protect the knee joint of the child. What child will be doing is, come on your knees. Come on, kneeling position. Yes. Now, you might have a question that, ma'am, how to support a child who is not able to come on kneeling on their own? Go into side sitting. Take your legs out. Now, suppose your child is sitting in side sitting position or W sitting position, then how you will get your child into the kneeling position first? So, what I'll do is, I'll ask the child to hold the chair. Okay. Now, slightly try to pull the chair. Come on. Don't do. I'll do it. Again, we'll do it again. He moved his legs. I'll be moving it, okay? Okay. You have to hold the chair and try to pull the chair. Okay, slide. Yes, 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 yes. And then slide the legs under the hips. Now, make sure your child has a cushion so that the knee doesn't get, the knee joint doesn't get that much stress. Okay, try to lift up, lift up, lift up, and then put your leg over here. Okay, so that your child is able to maintain the position. Slightly slide the hips. Okay, fine. So, now make your child assume the static kneeling position for minimum 30 to 40 seconds. And you can give some activity in front. You can even ask a child to play with the ball. Just hit it on the chair. Take it back. Okay. Do it for 30 counts. So that way child will remain engaged in activity and at the same time will be maintaining this static position, which will help in improving their balance and improving the static strength of the hip muscles. And see, I am providing support over here at the waist. Okay? Okay, fine. You can even ask your child to draw something in front. You can put something over on the chair, a book and the colors, and the child can do any activity in that position as well. But make sure the child is not taking much support on the chair and is trying to maintain this position on their own. I am providing support over here. I am providing stability. Okay, fine. Now we'll go on for one next position, and that will be the last one for this video. There, please come back, slightly backward. Steady. Okay. Now what we'll be doing is we'll be going in half kneeling position. Okay. Certain side sitting position as you were sitting. No, face on towards the chair. Okay, yeah, that's fine. Now, what I'll be doing is we have to take this leg in front over here. And try to get up. Hold the chair. Okay. Try to get up. Up. Okay. I am providing support over here and trying to take the knee on the cushion. Okay. We'll maintain this position. Fine. Great. If the child needs more support, you can put your leg in front as well, so that this leg doesn't slide much forward and the child maintains this position. Okay, this will also going to strengthen the muscles. And yes, try to come up slightly. Come up. Good. Take this forward. Fine. Provide support over here. Try to straighten your back. Leave the chair. Okay. Straighten your back. Come back. Come. Like this. Okay. See, I am providing support over here. Okay. Over here. And again, you can play with the ball. And yes, hold it from pelvis. Good. Try to hold this for 30 seconds and repeat it on both the side legs. At present, the right leg is in front. Practice it on both the sides. Okay? Relax. Sit down. You can sit on the chair. Thank you. Now, in this exercise, we will be targeting again on the anterior thigh muscles. We will be doing sit to stands or kind of squats. Okay. Make sure you are giving support over the feet. Make sure they are touching the ground. If your child's height doesn't match, you can use a lower stool or any supporting surface. Hold my fingers. Pull it and come up. Up. Down. Repeat this sit to stand activity for 10 repetitions, 10 times and 2 sets of it. You can lower the height as and when the strength increases. lower the height when the hip muscle strength increases. Yeah. So I hope these exercises will be helpful to you and you will be able to execute this with your kids. If you have any queries, then do let us know in the comment section below, and please do give your suggestion. And if you have not subscribed to our channel, then please do subscribe to our channel and support us to continue work in this field. Thank you and lots of love to all kids.